Good evening. Today's topic is National Program for Prevention and Control of Non-Communicable Disease, that is NP-NCDs. So, the full form of NP-NCDs is National Program for Prevention and Control of Non-Communicable Disease. But in earlier, this program was called NP-NCDs. This was a very popular program, NP-CDCS, that is National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke, that is NP-CDCS. CDCS stands for Non-Communicable Disease, like C for Cancer, D for Diabetes, next C for Cardiovascular Disease, again S for Stroke. So remember one thing, now the program name is NP-NCDs, that means National Program for Prevention and Control of Non-Communicable Disease. Previously this program was known as NP-CDCS, that means National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke. So let's start the program. Under this program, World Health Assembly, May 2013, adopted the following set of NCD target, that are 9 voluntary global NCD target, that is the target under this program which should be achieved by the year 2025. Let's see the target. At first, premature mortality from NCD 25% reduction. 25% reduction of premature mortality. Then essential NCD medications and technologies 80% coverage. In this purpose, nowadays the responsibility of community health worker is NCD based, so the coverage of NCD medicine and technologies. Then drug therapy and counseling for 50% coverage for NCD. Diabetes, obesity 0% increase. Raised blood pressure 25% reduction. Nowadays in many sub-center, hypertension drug is very common. Tobacco use 30% reduction. Salt or sodium intake 30% reduction. Physical inactivity 10% reduction. Alcohol 10% reduction. So the 9 voluntary targets by NCD program which should be achieved by the end of the year 2025, that is premature mortality from NCD 25% reduction, essential NCD medications, drugs and technologies 80% coverage, drug therapy and counseling 50% coverage, diabetes or obesity 0% increase, raised blood pressure 25% reduction, tobacco use 30% reduction, salt or sodium intake 30% reduction, physical inactivity 10% reduction. That means all the people should be physically active without respect to any age. Then harmful use of alcohol 10% reduction. That are the 9 voluntarily set goal. Then evaluation of NP-NCDs. Previously told that this program was previously known as NP-NCDs. Let's see the evaluation. In the year 2010, the program NP-CDCS launched. Okay. In the year 2013, scaled up in phased manner to cover all the districts in the country, and substitute of under National Health Mission. So this program was launched NP-CDCS in the program related to non-communicable disease launched 2010, and in 2013 this program scaled up to cover all the district in the country, and it is added to National Health Mission. In the year 2016, initiated population based screening, that means every people in the population should screening either a non-communicable disease present or not. Population based screening or PBS of common NCD as the part of the comprehensive primary health care, and in 2023 NP-CDCS renamed as NP-NCDs, and inclusion of some disease like COPD, chronic obstructive pulmonary disease, CKD, STMI and NAFLD. So these diseases are added into this program NP-NCDs. Then objectives of NP-NCDs. What are the objectives? Health promotion through behavior change with involvement of community, civil society, media, community-based organization and developmental patterns. Okay, health promotion through behavioral change. Like behavioral change, reduction of smoking, reduction of alcoholism, drug therapy, physical inactivity reduction, that means increase the physical activity. So these are the health promotion, and this health promotion technique we can counsel the people by the IEC or in information education communication. Then screening, early diagnosis, management, referral and follow-up of each level of healthcare delivery to ensure continuum of care. Then build capacity of healthcare providers at various levels of prevention, capacity building of the healthcare prevention and skilled building of them at the various level of prevention, early diagnosis, management, treatment, follow-up, rehabilitation, IEC, BCC, monitoring, evaluation and research. So these are the objectives. Then strengthen supply of chain management of drugs, that means as much as possible drugs, logistics, diagnostic kits should be available there where the NCD treatment are possible. Then monitoring, supervision and evaluation of programming through proper implementation and uniform ICT application across media. That means monitoring and supervision also very important, that the drugs and diagnostic tests are effective or not. Then to coordinate and collaborate with other programs, departments and ministries. Collaborate should be there. Then the strategies of NP-NCDs. What are the strategies? These are very common: health promotion, screening, early diagnosis, management, referral, follow-up, capacity building of the staff, evidence-based practice, uninterrupted drug and logistics supply, task sharing and people-centered care, information system for data and entry and longitudinal patient record, monitoring, supervision, evaluation, surveillance including technology-enabled intervention, multi-sectorial coordination and linkage, then telemedicine research, immediate research of NP-NCDs or non-communicable disease. Then organizational structure, national division, state division and district division. National division is headed by Joint Secretary of Ministry of Health and Family Welfare. State NCD register headed by Mission Director of NHM, and district headed by District Director. And the function of the various kind of organization. At first, National NCD Division. These are the nodal agency. Implement national multi-sectoral action plan, develop technical operational guidelines, short action plan, treatment protocols, training modules, quality benchmark, quality assurance, monitoring, reporting system and tools, IC materials, BCC materials, capacity building, integration of other national health program, release of fund as per state, monitoring and joint supervision. And the state NCD division, state action plan, presence of human resources, capacity building, maintains district-wise epidemiological profile, ensure regular supply chain, monitoring and designing of IC material, preparation of state PIP policy, release of funds according to the district, screening of the NCC, submission of state expenditure and utilization certificate, organize state and district level capacity building training. Then the district NCD division, district action plan, pressure of human resources, maintain district epidemiological profile, ensure regular supply of the chain, drug, logistic, monitoring the IEC materials, preparation of district PIP, release of funds to blocks, urban peoples for the screening of the NCD as well as rural, submission of state expenditure and utilization certificate, organize capacity building training at the all level of the institution. So these are the function of the according to the various level. Then monitoring and evaluation, program monitoring, all programs should be monitored either or not, supervision and evaluation, and also learning. So these are all about the NP-NCDs. If you have any doubt, then ask me in the comment section. Okay, this is very important as a 5 marks short question, 5 marks short note as well as short question. Okay, so thank you.